Hello, I am Dr. Sushanth Shivaswamy. I am a consultant neonatologist and pediatrician at Manipal Clinics Brookefield and Manipal Hospital, Varthur Road. Today, I would like to talk about newborn care. Having a newborn is probably one of the most enriching and fulfilling experiences for any parent. At the same time, the flip side is that it is also a period of extreme confusion, sometimes panic and fear. However, having some information about what is to be expected and what to look out for relieves a lot of this fear, confusion and panic among parents. The baby needs a good, comfortable environment at home to be comfortable. Make sure that the baby has enough space. The mother and baby should have a spacious, preferably nice sunlit room to take care of the baby. The mother's antenatal visits, vaccinations and nutrition and a general health checkup should be ensured during pregnancy. And as soon as the baby is born and is shifted home, the room that the baby is cared for should ideally be nice and warm and should not have any air drops. Most newborn babies, especially when it is a full-term normal delivery, tend to have very few medical problems and would typically be expected to go home by 1 or 2 days after the baby is born. However, especially with preterm babies and sometimes also post a cesarean section, you would expect a lot of these babies to have temporary transient breathing problems, sometimes necessitating NICU care. Also, some babies, especially preterms, tend to have issues with temperature maintenance where they have low body temperature, issues with sugar level maintenance which may require certain interventions with feeding or IV fluids. Neonatal jaundice is also a very common problem which tends to worry a lot of parents quite often unnecessarily, because neonatal jaundice is normal and in most of the cases, 95 to 98% of the cases would not require any intervention short of good breastfeeding. However, a small minority of those patients may require phototherapy and the need for which will be decided by your neonatologist. Other problems that a newborn babies face sometimes can be blood infections or other issues which tend to be rare. So any baby which has extreme irritability, where the baby is crying continuously for more than 3 to 4 hours without a specific reason, any baby who's very sleepy, most babies tend to sleep for 2 to 3 hours after a feed and then wake up for a feed. But any baby which is continuously sleeping for more than 6 to 8 hours without demanding feeds, any baby which is vomiting repeatedly. So here it's very common for babies to bring out a little amount of milk after each feed, but a large amount of vomit or repeated vomiting which is making the baby very tired would be an indication to take the baby to the hospital. Any baby whose yellow tinge, but which can be normal, but then which also involves the palms and soles of the baby, or any baby who doesn't pass urine once in 4 to 6 hours, every 4 to 6 hours, needs to be seen urgently by a neonatologist. The most important thing that a parent can do to ensure that the baby stays healthy is to ensure that you breastfeed the baby. Our aim is to exclusively breastfeed the baby, meaning nothing other than breast milk, no water, no external milk for the baby for the first 6 months. The only evidence-based intervention which helps ensure the health of the baby, reduces risk to baby's health, reduces mortality or deaths in the baby is breastfeeding, and that is probably the best thing, the easiest, the most cost-effective thing that can be done by a mother, a gift that she can give to the baby. So exclusive breastfeeding for the baby. Burping the baby well after every feeding ensures that the baby's tummy stays soft, that the excess gas doesn't build up and doesn't cause any problems. Ensuring that the baby's regular neonatal visits are done with a pediatrician or the neonatologist as prescribed at discharge. Keeping the baby warm, especially covering the hands, feet and the head so that the baby doesn't lose excess heat. Feeding the baby on schedule every 2 to 3 hours and eventually as the baby grows on demand, and ensuring that the baby's regular vaccinations are done as per the schedule advised by your pediatrician. These are the very important things that you should look for in a baby. In addition, ensuring hygiene at home, avoiding overcrowding, ensuring that you wash your hands while taking care of the baby frequently, and avoiding frequent visits by too many people, which can increase the risk of infections, are the other important things that you should do for your newborn to ensure that your newborn is safe and healthy. So as a parent, by following these simple things, looking for the common problems that can happen in a newborn, being aware of the red flag signs in a newborn, and ensuring that you do your timely neonatal checkups, you can ensure that your baby stays healthy, fit, and does not have any significant health issues in the short term.